Welcome to The Public's Health, a show that tries to put the public back in the public health. I'm Dr. Anthony Iton, Alameda County Health Officer, and this is your show. Today we have a wonderful panel and a complicated topic that we're going to try to address systematically if we can. We have some of the county's foremost experts in violence prevention with us today. We're going to hear a bit from our retiring Sheriff, Charlie Plummer, and we're going to have a quick tour of West Oakland later on in the show to talk about some of the physical features of the environment which may be contributing to violence. I'm pleased to welcome our panel today, and let me introduce them. On my right is Arnold Perkins, the Alameda County Public Health Director. And then we have David Muhammad, the Executive Director of the Mentoring Center, Valerie Street, who is the Alameda County Public Health Department Violence Prevention Coordinator, and Reverend Raymond Lankford, the Executive Director of Healthy Oakland. Correct. In West Oakland. We're going to try to talk about West Oakland today as a case study if we can. All of you have been involved in violence prevention for a long time. And so what I'd like to start with, and I'd start with you, Arnold, is talking about your perspective on West Oakland historically, what you've seen, how things have changed, and what your vision is for violence prevention in Alameda County.
When I first came to California from Florida in 1950, we arrived in Oakland, and the California Hotel, which is on San Pablo near Emeryville, was a booming enterprise. You had Cab Calloway coming through there, Duke Ellington, Count Basie, and many of the stars of the time. And over time, and the economy was booming. You had the Ford plant, the GM plant. You had the Del Monte Cannery, et cetera. All World Airways, all going full blast. And so the economy was thriving. Over time, as those different corporations pulled out and went elsewhere, you saw the economy decrease. The West Oakland community became destabilized. People started moving out to East Oakland, Richmond, East Palo Alto, other areas trying to survive. You begin seeing that community move toward disrepair. And I coined the phrase dis-ease. The community began experiencing a lot of dis-ease as the transportation modes were changed, as the educational system fell in disrepair, as employment ceased, then the community began suffering. And the community is at that place now suffering, and many of the people there have forgotten the rich history of West Oakland. Part of the solution that we see within the environment is to encourage people to move in the direction of self-reliant with assistance from the city and from the county and from the faith community and other entities. Because there's nothing that anyone is going to do for West Oakland but what West Oakland has to do for itself. So the approach that I take is encouraging people to move toward being as self-sufficient, problem-solving within our community. And we have institutions like Healthy Oakland that helps residents in that community reclaim their greatness, help them understand from whence they came, and help them understand that they can get employment, they can get education. So back to the can-do attitude.
Great. Reverend Lankford, what do you think about that vision for West Oakland? And tell us about your personal involvement in West Oakland and what you've seen happen over time.
Well, I was, like Arnold, I was born in West Oakland, so around the time he came, I remember West Oakland as a very vibrant community. When Climax High School was nationally known and acclaimed for not only its exploits athletically, but also academically. There were restaurants, there were small businesses. Prostitution was always one of the major issues, but it was among adult women. Today, what we're seeing is prostitution among our youth. We're seeing a rise in violence. We're seeing chronic health ailments of disproportion among all of our community there, particularly African Americans. And so it's a challenge, but yet it's still probably one of the most organized communities in terms of nonprofit organizations, the location where it's at, the memory of the city. And so Healthy Oakland is partnering with many other organizations to make a difference and a change in that community.
Great. David Muhammad, you're an expert in mentoring youth and engaging in strategies to try to prevent violence. What has happened in West Oakland? We've heard about this history of a vibrant community that has fallen on what clearly are hard times. What in your estimation, what has happened here?
Well, when I think about my involvement coming to the Mentoring Center and growing up in Oakland, my father was the director of community action programs for the city of Oakland. My mother was a manager at that Del Monte plant. And they divorced when I was very young. My mom lost her job at the Del Monte plant. And what turned into a very good family turned into one of the broken families of Oakland. Later went to foster care and later was in the juvenile justice system, nearly dropped out of school, but through the help of programs like the Omega Boys Club, when we had one in West Oakland, was able to turn it around and go to college and come back to be able to serve my community. But often, it's very few people who grab on to the hook that's thrown out there, kind of in the sea of destruction. And if you look at West Oakland, it's a vibrant community, it's an organized community, but it's also a destroyed community and a devastated community. And so when you deal with single parent households, and I think when you talk about the advent of crack, period, in inner cities. I remember touring juvenile hall and they told me, well, this was the one wing we had in Alameda County, and then after crack, as the person who gave me the tour said, we had to build this whole new wing. And so that has devastated the community and causing some of the violent behavior and then the environment itself. But many young people don't have their father. The school system is abysmal. And therefore they engage in some of this delinquent behavior without a good social network. So the government system, the community that's supposed to be the village that repairs the gap in the family has failed itself. And then lastly, on top of that, many of these young people grow up in a culture of death. The music they hear on the radio perpetuates some of the most horrible behavior. The videos that they see, they're in class where teachers, they're in the back watching their PSPs and watching music videos instead of in school. And so these failing systems and the devastation of the community has led to the delinquent behavior.
Okay. Wow. So we're laying out the problem here. Valerie Street is the West Oakland Violence Prevention Coordinator. What do you see? Tell us about how you got involved and what you saw when you laid eyes on the problem that was now yours to grapple with.
Well, I can remember I've been involved with the West Oakland community probably for about 20 years. First in my role as the homeless coordinator for homeless programs in Alameda County. We had a number of programs back in the 80s that focused in West Oakland because we continue to have a large homeless problem in the San Pablo Hoover area. But when I came back this time in my role as violence prevention coordinator, it was just devastating to me to see just the physical blight, the numbers of young children prostituting themselves on the corners, the proliferation of liquor stores everywhere. It was just shocking, and it really caused me to go home and really think about how do I work within my agency and with other community partners like Healthy Oakland, schools, business, to make a difference in West Oakland.
Okay. Well, so you've laid out the challenge for us. We're now going to go to a roll-in of the Alameda County Sheriff, who's retiring, and hear somewhat of a slightly different perspective on violence historically in his 50 years of tenure, and be able to come back and reflect on that.
Hi, I'm Charlie Plummer, your sheriff.
Thank you so much, Sheriff Plummer, for being on our show today. As you know, this is a show called The Public's Health, and it's a show that we feel at the Public Health Department puts the public back in the public health by us going around the county talking to people that are decision makers, that are knowledgeable, that have information that we think we need and that the public needs to know about. What do we need to be doing to prevent the violence that we're seeing in the streets, let's talk about Alameda County. What are the elements that we need to be doing as a society to bring this under some control?
What has to be done is to get the families together and start paying attention to their offspring. So I really am an advocate for people to stay home, somebody stay home, take care of the kids when they get home from school.
So
otherwise, don't have kids. You get somebody that's working and taking care of their kids and trying to do it right, they're class act as far as I'm concerned. They're doing the right thing. A parent trait. Any idiot can make a kid, but not anybody can be a father. It's not a racial thing at all. A real man is a person who gets a woman pregnant and takes care of that responsibility, whether it's trailer trash, honkies, black, Hispanic, I don't care what it is. It's the class. We're not rewarding the working families like the people I just told you that appeared before that. Some of them were working 2 jobs. I talked to one lady there. She was working at McDonald's and also Burger King.
Wow.
Minimum wage. She's working 16 hours a day to try to keep that family together.
Yeah. You're already the sheriff.
Yeah.
But you're now the czar of Alameda County. And you have absolute control over the budget. And your highest priority, the people have told you, is stop the violence.
Right.
How would you do it?
If I were the czar.
You're the czar.
Yeah. Boy, I love that title. That would be great.
That comes after sheriff.
Yeah, I guess it does. With a city like Oakland, I call it a city in transition. They should have, for a city of 400,000, they should have at least 1,000 police officers, at least that many. It's becoming more difficult every day to recruit police officers.
Oh, so it's a recruitment issue.
Well, sure, it's a recruitment issue, plus city councils that aren't the sharpest pencil in the box who decide we're going to put a hiring freeze like they did in Oakland for 2 years. Well, I lost 300 officers during budget cuts in 1992. I still haven't gotten back yet. There's more to it than just putting more cops on the street, because that might take care of it's a Band-Aid. You need the Band-Aid before you go to the doctor. I mean, you know that. If I come into your office bleeding, you say, why don't you put a Band-Aid on it before you got here?
You also run the prisons,
Yes.
or the jails here in the county.
4,000 inmates, yeah.
Yeah, talk to us a little bit about that. The people that you see coming into the jails, the people that are going out, and this whole notion of rehabilitation versus incarceration.
With the more than 4,000 inmates that we have, we provide in my jail, in fact, it's the only accredited jail in California, the only one west of the Mississippi. We have more educational programs in our jail than any other jail in the United States.
Now, why? Why
Because
do
I
you
want
believe in
them,
that?
I want them to get educated. We have GED classes, get a high school diploma, which is a big issue now. Anger management, English as a second language.
You say you got to lock them up, you got to feed them, you got to make sure that they're medicated.
Yeah.
But then you go above and beyond that with education, working with the housing
Yes.
authority, making sure that they have
And
those
good medical
connections
care.
and good medical care, right?
good
And
medical
we
care.
we see that.
Yeah.
We're very 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 proud.
And it
of
was
that.
terrible when I became sheriff. It was terrible.
You've talked about families, how important families are, and so you do what you could to hold them together, and maybe some of that is encouraging people in the workplace as opposed to encouraging them not to work, or creating disincentives to work. And you would do something about the guns, presumably, because you've mentioned that as
Fight the NRA, I've done that.
as a big issue, right? And you realize, that, as you've said, that the number of police officers that you need on the streets is more than we have.
Oh, yeah.
But it's not the whole story.
No.
So you're advocating really for sort of a balanced approach, looking at the family, looking at some of the weapons and the other instrumentalities of
Education.
harm.
Yes.
Looking at education, rehabilitation in the jails, and working with people once they go outside, or at least creating the connections in the outside world for them.
They need that bridge.
And also doing the increasing the policing. There's nothing more powerful for me in public health than having a leader who's committed to public health within their organization.
Well,
and
good.
that is what you are. That's why I wanted you on
Make
this
a good
piece.
team here.
It's
Yeah.
critical. It's critical. I mean, I can say all I want, but to have it coming from the sheriff, that they're listening to that. To talk to you in the context of sort of a longitudinal view over Alameda County, I mean, that's priceless.
When I first met you, you were speaking to the breakfast group, and I thought, I've been around here a long time, and I've seen health directors come and go. you're the greatest thing that's ever happened in this county.
Thank you very much.
I mean, you started calling people fat that morning, and look what you're eating. And I thought, wow, we got an honest man here. We got an honest man, you know?
That's going to be the undoing of me.
No, it won't. No, it won't be.
We're back, and we're joined now by another special guest. Africa Williams is the Community Building Coordinator for the City of Oakland, and she's working in West Oakland. Welcome, Africa.
Thank you.
Tell us about your perspective on West Oakland, what you've known about West Oakland over time, and what brings you to the work that you're doing.
Wow. I really just want to start, how I, came to go to West Oakland. I've been a native of West Oakland for a very long time. Went to schools from Westlake, Frick, throughout, Oakland. But I was bused out of West Oakland for high school. Which meant that there was an outlet, there had to be an outlet for me to be there. East Bay Conservation Corps was how I began at age 13, organizing, working with the community on small projects on how to keep the environment safe and clean. West Oakland right now is really going through a lot of huge changes where the young people don't feel like they belong in the community, so they feel like they have just no hope. And it really is, getting to a point where the people are feeling like they have no hope and they're leaving also. So there's a great deal of despair, but there's a lot of hope in that. Working with the City of Oakland, I began about 2 years ago now, working with this project that began to search out for residents who are involved in their community and wanted to do more.
Great. So we've laid out some of the problems and the historical issues that we've seen affect West Oakland. Let's talk now about strategies. I'm going to turn to David and ask you, if you had a blank sheet of paper and you had to draw up some key strategies that we at the county or the city or interested community-based agencies would need to sit down around a table and try to start implementing in concert with the residents of West Oakland, what would some of those key strategies be?
Well, first, sincere investment in the community. When you have a community that's really devastated, we need sincere investment in families. We need investment in schools. The education system in Oakland is horrendous. And there is a school-to-prison pipeline that's being built that the #1 indicator of future incarceration is poor academic performance. And I don't believe that there's any sincere investment in our educational system. And then in the systems that are supposed to catch you when your family, your community, and your educational system has failed. The foster care system, the social services system, we have a wonderful director in Chet Hewitt, but he's bound by the statutes and laws of local, state, and federal. The juvenile justice system is in shambles. We have some great people working there, but it needs a complete overhaul. And so we need true investment in it that really works to build assets in the young people. Ultimately, we can have great structures, but who are the people implementing the programs? You need what we call the mentoring spirit, where regardless of wherever a young person is or their current condition, you see them as a young person of unlimited potential and innate greatness. That you see this young person as a great asset, regardless of if they're exhibiting truancy or delinquent behavior, that in that young person is greatness, and it's our job as adults, as a system, as a community, to bring out of their greatness. And so we need an asset-based system.
That's interesting. So you're arguing more from the perspective of the child building outwards rather than from the institution building inwards. So there has to be investments, but the investments have to take the perspective of the children and the young people in West Oakland and look at their needs and prioritize what the institutions do based on those needs.
Absolutely.
That's an interesting perspective. Reverend Lankford, how about you? If you had a white sheet of paper and you had to draw up a list of the things that need to happen today, how would you bring people together and what would you ask them to focus upon?
Certainly we would encourage the asset investment that David has just talked about, and we would be more community focused, more community based, empowering the community to work closer with the families. Also ensuring that the families have proper treatment. Children can't raise themselves, they have to be raised and nurtured by loving, caring adults, which this is nothing new. We're talking about a community, African American community, that we traditionally had grocery stores, we had gardens in the backyard. We went to school, and we were trained by our elders and seniors in our community. And young men, you know, they took up various vocations and trades. So I would hope that we could, again, empower the community, but it should be those that are from the community, those who know the community, and that not just simply outsiders coming in because of the assets and the land that's available, but those that really want to make a difference and make a change in the community. And that community is the faith community, the education community, community-based organizations, everyone at the table to have a holistic and comprehensive plan to make a difference, and everyone should feel a part of that plan.
Great. So what I'm hearing again is this theme of investing in families, investing in the critical institutions like schools, investing in community, bringing people together to give them a voice and an opportunity to chart the course of that community. So these are real challenges because our current system doesn't really do that.
No.
We really have this individualistic focus on every man for himself. If you've got money, you can get it. If you don't have money, you're on your own.
Right.
So you've heard the challenge now. Valerie Street is the violence prevention coordinator from two of our experts. What's the county and the city going to do about this? How are you going to address this?
I'm glad you raised that, and that adds a fourth leg, and I think government needs to change. We that exist in the belly of the beast have to be the most vocal advocates for change within the institutions as well. These communities don't look the way they do out of nowhere. It's governmental policies. I often say 80% of the problem in community is government, not people. They do to community as opposed to with community. And we need to make a change. And one of the things I will continue to advocate for is institutional change, that government has to become a partner with community in sincere investment to make a change. And that's really how I see my role as well.
Let's get a little specific here. What should the government be doing in West Oakland? What should the county government be doing in West Oakland today, right now? And I know that you're actively engaged in processes right now. What are you doing? Why are you doing it? And how is it going to make a difference?
Well, we're involved in a community capacity building project in West Oakland. It's really a three-pronged approach. Number one, it's really getting to know the residents and really working with the leaders of different groups to say, hey, what are you seeing as priorities of things that you would like to see changed in West Oakland? So we're forming neighborhood groups, resident groups, to really begin advocating for change. The next level is actually connecting people to service systems. It's hard to become an advocate when you're struggling every day to just survive for your next meal, your next pair of clothes. If we can make a connection for families and people to get the basics that they need, then they can have a little headspace to be able to take the next step, which is to become a community advocate. So we're also trying to change some health indicators. We will be trying to boost immunizations in the community. We will also be trying to get people linked to health insurance because your health is your wealth.
Sure.
And without health, you can't even think ahead. So if we can begin to make those vital connections in community and people accessing service that they need so they don't have to drink in these liquor stores every day, then maybe we will have made a difference in the long run.
We're going to get back to the liquor store issue in the second half of the show. I wanted to go to Africa and ask you, you're on the streets every day now. You're working with these communities in partnership with Valerie, in partnership with Reverend Lankford, in partnership with a number of different institutions and organizations that are committed to making a difference in violence. We've seen now citizens marching on City Hall demanding more police. We've seen a spike, apparently a temporary spike in violence in Oakland. What's your sense of the time frame over which you're going to see change, given all of the investment and the effort that's happening on the ground now in West Oakland?
Wow.
Is this going to be something we're going to see change soon, or are we talking about a longer-term investment?
Wow, no, I definitely think that there's a long-term investment that's going to be going into seeing change in West Oakland. With a lot of people involved in our community groups, they are starting to see that there's something that I have to contribute as a community member, as a citizen of Oakland, that is much more than me going to a meeting. It means reaching out to what Mr. Muhammad was saying about reaching out to our young people, finding out what are the assets that, not only what these young people have, but what is it that I can give to make things a little bit safer for our communities and safer for the people that we're living around. So,
how do people in West Oakland get involved? They hear this and they say, wow, this is a dynamic group of committed people who are ready to take this problem on. I want to roll up my sleeves. I want to get involved. How do I get involved as a resident of West Oakland or a resident of Oakland or elsewhere?
Yes, definitely just start where you are. You know, if you have a business, if you have a home, if you live in a housing authority, just going out and picking up garbage every day, you can become a part of adopting your block, adopt your drain. That's a small difference that is huge to people who live around you. People start to notice when the front yards are cleaned out. Also, you can maybe go to your local church in your community. There might be a place where you can help out in the kitchens. Mother Wright needs help all the time. Really look into the schools in the community. They will definitely need a lot of tutors in the community.
Okay. Great. Well, we're unfortunately out of time, and I'd like to thank my guests for this relatively brief but very insightful discussion about violence in West Oakland. Next month's show is going to follow up on this theme. It's going to continue with these guests, and we're going to talk about some of the physical environment and the social environment in West Oakland and how that contributes to creating unhealthy environments which may, in fact, contribute to violence. So thank you very much for coming, and we'll continue with you next month.